words fail, music speaks. Hans Christian Andersen. After silence, that which comes nearest to expressing the inexpressible is music. Aldous Huxley. Music gives a soul to the universe, wings to the mind, flight to the imagination, and life to everything. Plato. Music therapy can make the difference between withdrawal and awareness, between isolation and interaction, between chronic pain and comfort, between demoralization and dignity. Barbara Crow. Almost all children respond to music. Music is an open sesame, and if you can use it carefully and appropriately, you can reach into that child's potential for development. Dr. Clive Robbins. Well, all of these quotes are really great, but what is music therapy exactly? Under the umbrella of the creative therapies such as dance, art, and play therapy, music therapy takes its place through the use of music to reach an established goal. It is a research and evidence-based practice used by a board-certified music therapist in a clinical setting to treat multiple populations throughout society. The first records of research in music used in the health field come from the 1700s, but continue with further explorations to the 1800s and 1900s. After World War I and World War II, practices implementing music in the healing of soldiers returning home became prominent. It was after this era in the 20th century that the National Association for Music Therapy was founded. Later, the American Association for Music Therapy was founded in 1971. These two organizations were similar in function and later joined together to form what is now called the American Music Therapy Association, or AMTA. With the creation of an allied association for music therapists came the eventual development of a certification board, which ensures that every practicing music therapist is properly educated and licensed to practice. With history spanning from the 18th century onward, it is the research guided by modern music therapists that push the profession forward on its path. So let's talk about some goal areas that music therapists might focus on. The first one is motor. So this treatment domain covers things like gross and fine motor skills. Gross motor skills being large movements and fine motor skills being small movements. Some other things in this area are proprioception, that's knowing where a body part is without looking at it, balance, mind-muscle connection, and of course, sustained movement. Under the academic and cognitive treatment domain, we could be working on things like direction following, group work, comprehension, number recognition, letter recognition, and literacy. There's other cognitive treatment domains that we might look at, things like sequencing or geography learning or even spatial learning and mechanical learning as well. Group work could fall under social and communication treatment domains as well, but some other examples of this could be shared experiences, peer interaction, receptive communication, interpersonal communication, and of course, expressive communication. Music therapists also work with clients on emotional and behavioral goals. In this treatment domain, we could be working on stress relief. We could be working on direction following and appropriate use of instruments, specifically in the music therapy room. But these concepts translate to other areas as well. And also coping mechanisms and developing those coping mechanisms through music therapy. three facets of music therapy, and these include music listening, music performance, and movement to music. These are the three ways in which music therapy can occur in a session. This is a lot of information about music therapy, and you might be wondering, what populations do music therapists serve? Well, I'm here to clear that up a little bit. Music spans culture, religion, race, ethnicity, geographical location, and pretty much anywhere in the world you find a human, you'll find music. So, consequentially, we treat a lot of different populations: developmental disability and intellectual disability, geriatrics and older adults, hospice and palliative care, hospital populations across age range, physical rehabilitation clients, prison and correctional facility inmates, drug addiction populations, as well as mental health patients. The last thing I want to leave you with is this question that a lot of us ask ourselves. How is a music therapist different from a music performer? Well, the fundamental difference between a music therapist and a music performer lies in the therapeutic triad, where a musician establishes a relationship with the audience through the performance. A music therapist establishes both a music relationship and a therapeutic relationship. The therapeutic triangle in music therapy is best described as follows. This is the way I like to look at it. The music is the tunnel that both the therapist and the client walk through together.